Poor health is at the core of much of the world's poverty and suffering. This is especially true in places where poverty is endemic and diseases like typhoid, tuberculosis, malaria, and HIV/AIDS are widespread. In sub-Saharan Africa, the large majority of children's deaths and premature adult deaths are preventable by relatively simple and inexpensive interventions. Yet these simple interventions remain out of reach for the majority of the population. In Kenya, a shortage of health service providers, poor roads and infrastructure, and limited government support all contribute to the lack of health services available to the estimated 80% of Kenya's population that lives in remote areas of the country. While the government does provide healthcare service at the district level, those services have difficulty reaching Kenya's mostly rural population. The underlying problem is this gap, referred to locally as the last mile, which all too often proves to be too far. In many cases, it is the largest hurdle preventing rural families from gaining access to life-saving health services. Working to get these services where they are most needed, the National Cooperative Business Association, or NCBA's CLUSA International Program, has been working in Kenya since 2001 at the grassroots level. Along with their partners, CLUSA is helping more than 5,000 communities by training more than 10,000 village and community health workers, which provide access to basic health services formerly not available to these communities. Through these efforts, CLUSA is empowering the community to build a sustainable path toward improved access to health services based on local engagement and grounded in cooperative principles.
So what CLUSA brings to the table is that community mobilization approach that is very evolving and participatory and, brings, creates demand for the health services that are set by our other partners.
Under USAID's AFIA Plus program, in partnership with Pathfinder and other national and local organizations, CLUSA leverages the existing healthcare system and reinforces it by linking community leaders with available resources and explaining how forming community health groups can bridge the last mile gap in healthcare services. By starting at the grassroots level, the villagers are empowered and have a say in their community's future. That is the beauty of the cooperative approach.
Such that the community members, at the end of the day, own the program, not the program owning the community members.
Cooperatives are a well-known business model based on ownership and community input, equipping the local residents with the tools they need to link to existing support organizations or create new ones, which are designed to meet their needs. While CLUSA provides the initial training, all the decisions are made at the village level. Through this process, the villagers themselves collaborate with potential partners to provide what is needed, whether it is transportation services, dedicated clinics, medicines, or other supplies that can be used to increase their community's access to health care. All those trained have the responsibility of sharing what they have learned with village volunteers, thus providing a systematic sharing of knowledge. A vital part of this process is guiding the village residents to do action planning. Multiple villages work together to better meet their pressing needs.
It could either be health plans, they could be general plans to address their own issues at the village level.
From these plans, health committees are formed to address community health.
The overall goal of CLUSA in Kenya is to empower and inspire Kenyan communities to address their own social, economic, and political needs using democratic cooperative principles. We use a CLUSA approach, or what is normally referred to as the CLUSA methodology, that adheres very closely to the cooperative principles, that looks at democratic control, decision making to the people, one vote, one person, and generally gives responsibility to the local people.
By ensuring that the villagers retain the responsibility of implementation, the CLUSA approach provides participants with a true sense of ownership of the program. This ensures the community that the program will continue running long into the future without further need of outside intervention. These steps, from a village perspective, are seen as the first mile to gaining sustainable access to health services, and progress is already being seen in the communities. Due to the training received on preventative health techniques, many villages have seen a decline in illnesses. Between 2011 and 2012, cases of malaria have declined, with 42% more people sleeping under treated nets. HIV care and treatment has increased by 66%, and pregnant women are getting the care they need to provide better nutrition for their infant children. Reliable access to health services creates healthy people. Healthy children learn better. Healthy parents can work and earn money to sustain their families. The standard of living is improved for the community as a whole by implementing better sanitation practices that are learned through CLUSA's training. In addition to health services, community members can use the CLUSA approach to address other issues they feel impact the health of their community.
Health might not be the primary issue. They might be looking at even just simple issues like access to food, or even just access to water, access to, transport to take their produce to the market. So we address, as much as we want them to address health issues, we also give them an opportunity and the skill to be able to plan and come up with other issues, link them to other partners who have those resources which the project does not have.
Through the cooperative approach, people are free to create additional groups as needed. These groups then form the strong foundation of a village, allowing it not only to grow, but also thrive. In Kenya, cooperatives are an important part of the landscape and are a concept that is understood and appreciated by local communities. According to the International Cooperative Alliance 2012 statistics, 1 out of every 5 people worldwide is a member of a cooperative. That means that cooperatives touch the lives of millions of Kenyans. As for Kenya's economy, cooperatives are responsible for 45% of the nation's GDP and 31% the national savings and deposits. This approach has proven to be highly effective in mobilizing and empowering local people to meet their health needs, combining the best ideals of democracy with a practical grassroots approach. With the tools provided by CLUSA and its partners, villagers regain control of their future and work together to meet their needs and define their own destinies.